I think the key part I've come to realize is getting a PhD in me was the foundational before ever working on a PhD path, and partly because you learn so much in the process of who you are, or as in Oprah Winfrey says, whose you are. Because when you do that, if you master yourself, you can never be a slave to anyone else. And I find that to be incredibly important because while we believe that slavery is over and abolished, the reality is life sometimes can feel like a performative plantation, and you deciding on which role will you play in the midst of this show. Um, but to know that your identity, whether that's taking on the avatar of a Harriet Tubman or Frederick Douglass, it's so critical to know which footsteps that you're walking in order to guide your path, just as people identify with, Jesus Christ and their path. It's important to know that we're never alone in this journey of life, but it's your ability to identify who your tribe will be and how do you have a vibe that attracts the right one in order to move in the direction you want to go.
And shifting a little bit here, what does public health mean to you?
Public health for me is the forest. It's people who represents the trees that represent the different disciplines from epidemiology, biostatistics to policy to the educator. Management all play critical roles in the system of building a strong public health system. And we saw that with this pandemic of our lifetime, with COVID-19, of really showing how and why public health matters. I hope much can be taken away of the need to build strong, resilient systems at all levels, hyperlocal to state and national. That public health represents the soft savings of healthcare. You may not always see the effects of it, because if we've done our job right, it would have been prevented. But the goal is to reduce the cost, reduce the impact on life, and improve quality of life for a population level, because it is the way in which we build a strong national security system. I think when you consider military, right now they're seeing the effects of childhood obesity as those young people become adults and not being able to be fit to fight for our freedom, and the need to have a second component of a boot camp just to prepare them to become a healthy, viable soldier that can be deployed in defense of national security. So as someone who's been a born national security scholar and at one point a nominee for West Point, I'm super mindful of what it takes to build national security is very much in lock with public health security as well, and that means also nutrition security.
And how does nutrition security tie into that?
Well, partly let's just start with a kid in the classroom. If you have a hungry belly, it's hard to concentrate on the education that the instructor gives you. Not only that, you have, a cognitive decline. Also, when we think about the person who shows up at the workforce, they have a need to be high performing. And so again, if their ability to not take in proper nutrition for their brain health as well as their physical health, in terms of their gut, if they're always, having those signs and symptoms, just like a car, when lights come on and no one's home, like that's a time where you end up having absenteeism, having to always be at the doctor's office. You can't really focus and do the job at hand. And then you just have the overall effects as a population when you times that, of what is the economic impact on society, of just reducing health cost burden, and acknowledging the quality of life factor. So while we may be living longer, because of lifestyle factors such as our ability to manage stress, which we self-medicate with the food choices that we make, that we may not have the convenient foods that are in the forms of fruits and vegetables that people should be able to afford. That all ties into how are we managing. So if we're self-medicating with foods that what I call that will not sustain life, but just get us from point A to B and versus Z, that's not doable over time. Pocket wise, in terms of dollars, it doesn't make sense. And healthcare wise, it doesn't make sense at all. If we are always looking for a silver bullet in the form of a pill, it may give us immediate remedy, but over time, the goal is a lifestyle transformation. And that takes effort, willpower. That is why we have the power of free will to make decisions. And it's up to us to decide what do we choose to value. And sometimes it's between health and wealth decisions, but in the end, if you have no health, it doesn't matter how much wealth you have.